Hello, hello. So here we are for class 3, and I am praying that this runs smoothly. I went through and did a dry run, so cross your fingers. But in this class, we're going to do advanced visualization and deepening. So I'm excited. I hope you got to go through the other class and really grasp just the extra practice and the conditioning and really honing in on um, what you want your breath to feel like and look like, and really start motivating your mind to focus in on that visualization, and also talk about like your birth preferences, right, and start to figure that out, as well as doing the fear release. So we're going to do the fear release, and I'm going to tie it into one of the slides, and I'll let you know which one. So here we go. So we're going to start off watching a birth video, and the whole point is for you to really capture the possibility of how the beginning of your birth can look like, where it's very spaced out, very calm. It's like your daily life, and you just feel the pressure or the sensation just intermittently, right? And then you can go back to whatever it is that you're doing in the moment. So we're going to watch. This is a cute little Australian family.
Good morning, little baby. I think today is the day. Just started having some surges. Do you want to say something to the baby?
Hello, baby.
Are you excited to meet the baby?
Yeah.
Yeah. Do you want to say anything else?
I hope she come out today.
Today? That would be nice, wouldn't it?
Yeah. Kisses, hug.
Daddy?
Good morning to the baby. Friday the 14th of May. It's 8 o'clock in the morning almost. You almost could be at school, but you're not feeling too well. It would be...
Now what do you mean?
Now what do I mean?
Yeah.
Well, it's Friday. It's a school day, and on Fridays, children go to school. But your little brother, or big brother rather, is here. And I wonder whether today will be the day that we see you. You never know. Anyway, we look forward to seeing you later on. And Mummy, did you want to say a message?
Bye.
Love you.
Love you too. Mwah.
I watch you as you drive. Do you know I'm looking? And I can't help but smile. Do you know how much I love you? You put my favorite song on. I put my feet up, and we just sing along. And I can't help but feeling, just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever? Forever. 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 I watch you as you sleep. You don't know I'm looking. With you everything's complete. Do you know how much I love you? I put your favorite song on just to wake you up. When I dance around, I can't help but feeling, I'm just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever? Forever. 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 I'm loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here forever? I'm just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever? Forever. 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 I watch you as you drive. Do you know I'm looking? I watch you as you drive. Do you know I'm looking? And I can't help but smile. Do you know how much I love you? You put my favorite song on. I put my feet up, and we just sing along. And I can't help but feeling, just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever? Forever. 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 I watch you as you sleep. You don't know I'm looking. With you everything's complete. Do you know how much I love you? I put your favorite song on just to wake you up. When I dance around, I can't help but feeling, I'm just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever? Forever. 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 I'm loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here forever? I'm just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever? Forever. 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 I watch you as you drive. Do you know I'm looking? dry? Do you know I'm looking? And I can't help but smile. Do you know how much I love you? You put my favorite song on, I put my feet up, and we just sing along. And I can't help but feeling, just loving this moment. Can we stay here forever? I'm loving this moment. Can we stay here together? If I could stop the time, don't you know that I would? 'Cause I'm just loving this moment. Can we stay here forever?
Good morning.
So, what a beautiful moment, right? What a beautiful moment to share by that family and to have that support um, uh, and if you noticed, they had the birthing pool set up, but just like birth plans, you can have an idea of what you want to do, but then while you're birthing, you do what feels right. And she ended up wanting to go outside and be in the sunlight, that's beautiful, and she had the option. And so that's what she did. And I love seeing the smile on her face and just the bliss, that everyone's experiencing. And that's what that's what hypnobirthing is about, right? It's maintaining that bliss, it's maintaining that joyful perspective and keeping yourself in a joyful, relaxed state of mind so that your incredible body can do what it is designed to do without you having to do anything. So there are some extra visualizations, and I'm going to attach the PDF that you can print of this. This is the opening blossom that you can use as a visualization for when you are crowning. And you can see back in 2005, someone actually took the time to draw this specifically for this visualization in hypnobirthing. And it's definitely, it takes the cake. It's a beautiful way to understand how, how we do open up, right? We just beautifully open up to, welcome the baby, right? The blue satin ribbons. This visualization is also in the book on page 170. And then the blue satin ribbons, that's another one it's another visualization, but it's used for the imagery of your uterus and how it works and thinning and opening. As we showed in the in the details of the uterus, where it has the 3 layers, and it has the horizontal as well as the vertical muscles. The blue satin ribbons, you would visualize the blue satin ribbon, and I usually have a ribbon, but my children, daughter specifically and her girlfriends, got into my supplies. And so you can use a scarf, you can use anything, that just like gently wraps around your hand. But the idea is to show you how the circular fibers and the neck of the cervix, with each surge, right? Remember, the muscles pull up and push down on baby, while the circular muscle fibers, they open and then squeeze rhythmically with the vertical muscles to push baby down. And so you would visualize that the blue ribbon is representing the relaxation and the letting loose up and around baby, so that with each surge, they basically unfold, right? They just relax and unwind so that there's no extra tension, there's no extra tightening unnecessarily, so that they yield to the energy. Time distortion, that it's a very beautiful gift in birth, where if we just focus our mind into what we are already practicing, right? The visualizations and the breathing techniques, and our, staying in our birthing headspace, time distortion, it really starts to kick in, and then we lose track of time. Some people really experience where even seeing things is distorted around them, conversations. Excuse me. It's in the middle of the afternoon. Like, I don't understand why when I talk so much, I do that. Yeah, this is the wonderful gift that you want to utilize, and that's why the people around you should not constantly be telling you the time, or how long it's been, because then it kind of disrupts that and will make it feel like it's longer. And I can definitely vouch for that, because in our first birth, I kept looking at the time. I kept like wondering, oh, how much have I progressed? And it really slowed things down. So time distortion is on page 177. We're going to do some visualizations. These you can, this image of the opening blossom is in the workbook as well. So you don't even have to print it. You can just pull it out, or if you want like multiple areas that you can put it in, then you'll have the PDF that you can print as well. Okay, so deepenings, the glove relaxation, that is where you're going to visualize, and I'll use some of them in our visualization on the next one when we do our practice. I'm going to do the ultimate relaxation with, and I'm going to tie in the glove relaxation and depthometer, and the sensory gate valve, just some like cute little things that you can use that can help your deepening if you need some extra visualizations. But these are on 173, and it goes into just kind of redirecting something to help you create extra like weight in your brainwave frequencies, and just really heavening the relaxation and letting go, right? Having another focal point really helps to engage that relaxation, right? Let's see. One of the goals, if you get into birthing and maybe something is like disrupting your environment, having these as well, it enables our subconscious to basically use a focal point as like an anesthetic, right? For that deepening, to release those endorphins and inhibit the catecholamines, right? Remember, we want to restrict the catecholamines and the bad adrenaline that will bring up like the discomfort or possible discomfort. We want to re-engage like a stronger focal point for the natural pain relievers and just the natural chemical releases that are purposely there in design for our incredible bodies to utilize for the natural process of birth, right? So we don't want to hinder that. And so these are great deepenings for distractions, or maybe if someone disrupts us, or they're great for deepening. So yeah, the result is just going to help you be more comfortable and relaxed through your birth. So there's, learning it is just another tool to have in your toolbox when you're birthing and have that option. What's cute is the depthometer. You can basically read it like a thermometer, but you're kind of reading it like the numbers represent like how much deeper you go, and the sensory gate valve is it's like a switch, and it helps create that visual as well. I actually have an image of it. Where is it? So sorry, give me 1 second. I don't know, it's blocking it out. Oh, because it's picking up on my face. Oi, it's not picking it up. But if you were able to see it, jeepers cats, it's like a round gauge that looks like a switch, and then the other one, just looks like one of the glass thermometers, but that's okay. Okay, so on this next one, we're going to play some music, and we're going to do some relaxation and practice. So take advantage and make sure you don't have to go to the bathroom. Pause this if you need to go to the bathroom, and then make sure to get in as comfortable a position as possible. Relax your hands, relax your jaw, let your shoulders sink, and we're going to get into it. Okay, so I'm going to switch to the next slide. All right, here we go. We're going to practice. Okay, so if you are relaxed and ready, we are going to we're going to get started. Make sure you're nice and comfortable. Feel as though you can fully relax wherever you're laying or sitting. Allow your eyes to gently close, your jaw to unhinge, your shoulders to slump. Allow your mind and body to accept this gift of calm and serenity. And so we begin. It's time to relax and begin your journey into a place where you can allow yourself now and at any time you wish in the future to access an ultimate, naturally deepened state as you enter the birthing mindset. Allow yourself to drift into relaxation. Let that feeling of calm and peace spread throughout your entire body. With each gentle breath, you are becoming more comfortable, more calm, more confident that you can achieve an ultimate level of relaxation. This relaxation will help you create a birthing experience that will be even more joyous than you can imagine. resting while you drift into the soft stillness of your inner mind. Your breathing is becoming slower and deeper, and the pattern of your breathing is gradually shifting so that you experience the same feeling that you enjoy as you slip into a deep sleep each night. Give yourself permission to go deeper now. Breathe relaxation through your chest, your upper arms, your lower arms, your stomach, your thighs, your legs, your ankles, your feet, all the way down to the very tips of your toes. Relaxation washes over you now, creating that wonderful bliss of not having to think, to act, to defend, to support. Clear, easy thoughts just drift and float through the soft mist of your relaxed mind. You are free of any need to exert any effort to make anything happen. There is no right or wrong way to experience this calm void. You simply become more and more comfortable as you let your mind take over, and you do nothing but enjoy the ease of the rhythm of your breathing and your birthing body. Whatever is happening is being done for you by a body and inner mind that know and understand exactly what you need to birth your baby. Each breath transports you into even deeper relaxation. Endorphins flow and take you to far deeper comfort and calm. Now deep within this ultimate relaxed state, in your mind's eye, experience the imagery of a kaleidoscope becoming larger and larger and opening outwardly soft and freely. This dreamlike state and the vision of the kaleidoscope gives you even more comfort and security in knowing the knowledge that everything is perfectly designed for your birthing body to open easily and smoothly. And now that you have brought yourselves into this wonderfully comfortable state, picture in your mind's eye that within your body is a large, soft, flexible, inverted thermometer. We will call this the depthometer because we use this image to go deep in ourselves, to reach a relaxed state. Bulb of the depthometer is just above your forehead. And within the depthometer is a clear fluid of natural numbing relaxation. Your body's own natural relaxant. There are 40 lines on the depthometer. As I count down from 40 to 39 to 38 and so on, picture the fluid of relaxation gently flowing down from one number to the next, with each number bringing you deeper and deeper into relaxation. You will feel a deep relaxation gradually saturating your body as the fluid fills the space in the tube. As I reach each decade on the depthometer, 30 to 20 to 10 and 0, you will double your relaxation and reach a new, deeper level. Deep breath. Beginning to count now. 39, 38, 37, 36, 35, deeper and still deeper. 34, 33, 32, 31, and 30, doubling your relaxation now. Going into the 20s, 29, 28, 27, 26, 25, going deeper, 24, 23, 22, 21, 20, doubling your relaxation again. 19, 18, 17, 16, 15, still going deeper. 14, 13, 12, 11, and 10, doubling your relaxation. Now going into the single numbers. 9, 8, 7, 6, 5, 4, 3, 2, 1, and 0. Once more, doubling your relaxation. And now you are at the very center of your inner mind, control room of your subconscious. In that moment, because of the deep relaxed state that you are in, you may want to stay in this deep relaxation. It may be difficult for you to open your eyes, but take a moment to open close your eyes again. When I do, you will bring yourself twice as deep as you are right now. You are now deep within your own very special place of power, your own inner control room. As you look to the right in your mind's eye, see a large control panel with many lights and switches. In the middle of that panel is a large round valve. Above the valve are the words, hypnobirthing valve. This valve controls the messages that are sent from the brain past the sensory gate in the brainstem to all the nerves of the body. The indicator switch on the valve is set to on at the 12 o'clock position, the way it is normally as you go about your daily routine. When this switch is on, you can move and feel, and you would experience discomfort if you were to injure yourself. To shut off feeling throughout your body, all you have to do is turn the switch of the valve to the off position. That is at the 8 o'clock position on the valve. Do that now. Switch the valve to the off position. Find the switch in the center. Turn it off. Turn that switch and feel your body just droop into the deepest relaxation you have ever known. Feel a numbness and tingling. That numbness sweeps through your entire body, back of your knees, your legs, even your feet. And you feel the tingling at the soles of your feet. You'll know that you are directing the relaxation within your body. You will continue to feel sensations of pressure or movement within your body now, but you will no longer feel discomfort of any kind when the switch has been turned to off. The switch will be there for you during your labor if you should become distracted, or if you simply want to drift down deeper into relaxation. Now please, in your mind's eye, see yourself reaching and turning the switch over to the select setting. This is at the 4 o'clock position on the valve. You find now that you are able to move any other body part of your body, but you sense that all feeling has gone from your right hand. It's as though there were a silver glove of profound relaxation on your right hand. As you continue to place your awareness on your right hand, you feel the fingers of that hand become full, numb, and larger. You now become aware that your entire hand is beginning to become numb. Your hand and fingers feel bigger. In a few moments, you feel that sensation has gone from your hand. Your hand will feel almost as though it were like a piece of wood or a piece of leather, senseless. Imagine now that the more you put your awareness on your hand, the more your hand is getting numb, cold, and insensitive, as it would if you held it in a bucket of icy slush. As you imagine this, your hand is indeed heavy and feels numb and senseless. The hand has lost all real feeling, starting from the tips of your fingers and working up across your palm and the back of your hand. You find that your hand is free of sensation, completely numb and insensitive. To ensure that your body remains loose and limp during your labor, all you have to do is use the switch, and it will release that same effect as the glove of relaxation. You can place your gloved hand any place you wish to use it to relax parts of your body. Now, even though your hand is numb, instruct the hand to rise. Bring it to your cheek, just beside your mouth. Bring your numb hand up to your cheek, just beside your mouth. And now you become aware that the numbness is transferring to the side of your mouth, as though there were anesthesia in your cheek. Feel the tissues on the inside of your mouth becoming full and puffy, just as they would with anesthesia. Sense how numb your cheek feels and how large your tongue is beginning to feel. The entire side of your mouth has become numb with no sensation. Feel it. When you are in labor, remember that you can transfer the wonderful feeling to any part of your body. You can even transfer the numbness and relaxation to the lower part of your abdomen to add to your relaxation. You immediately go into a deep, comfortable relaxation. Very good. Now, take the fingers of your right hand and gently tap the side of your mouth so that all feeling returns to your cheek. Just tap, tap, tap until the numbness is gone and you can feel it. Back to normal. All feeling restored to your mouth and cheek. Now return your hand on your lap and restore the silver glove of relaxation to your hand. Now your hand feels heavy and numb again. As long as the select setting is still on, your right leg and right foot have become immovable. You cannot lift your right foot. It is too heavy. you to try and lift your right foot, but you cannot. It has become so heavy that it won't lift. It's stuck to the floor. And now, remaining in hypnosis, release your foot. Release your right leg. And restore that sensation. Move your left hand, your right hand, left foot, and right foot. Turn the switch back to the normal on position. Release the silver glove of relaxation and return all feelings back to your entire body. Return to normal. Body functions. Releasing. Lastly, you are ready to install the necessary keyword that will serve as an anchor to instantly transport you to a deepened state of relaxation in your inner mind. Your keyword will be the color you choose from your rainbow relaxation as your birthing color. For our purposes right now, we will choose the word lavender. You may substitute any color or any keyword you prefer as you practice. You will also install a second keyword that you will work with to bring you to a state of physical and mental alertness and energy. This uplifting keyword will help you immediately come up from the state of relaxation to assume a normal state. From this moment on, whenever I or you or anyone you choose says your keyword, you will take a short breath as you exhale, mentally recite 3, 2, 1, 0, and instantly feel your body drip down into the ultimate depth state or birthing, knowing it is safe and that you have the intention of reaching this ultimate depth to free your mind and body for birthing. Your body will immediately reach this ultimate depth. And you will enjoy the same relaxation that you are enjoying at this moment. You will still be aware throughout this time, even though you are deeply relaxed. And if you need it, you can resume a state of awareness immediately through this installation of your key word. You will learn to double and triple your relaxation each time you go deeper into this state. relaxes, your mind relaxes. So whenever I or you or anyone of your choosing says your keyword or lavender, you will take a short breath, exhale, and mentally recite 3, 2, 1, 0, and immediately triple your relaxation, feeling yourself drifting even deeper into this ultimate relaxed state. This will happen for you today and every day for as long as you choose, for whatever period you desire. Lavender. Exhale. 3, 2, 1, 0. Lavender. Exhale. 3, 2, 1, 0. Lavender. And exhale. 3, 2, 1, 0. Ultimately, deeply relaxed. And now rest. And now we will install the up or exit keyword, being energized upward, really bringing you up from the deep relaxed state, not hindering you from going back into the relaxed state, spiritually refreshed, physically energized. For our purposes today, we will use the up keyword of daisy. As you inhale, mentally recite 1, 2, 3. You will instantly come all the way back to your normal waking level, feeling mentally alert, physically energized, and spiritually refreshed. Will have the same effect as if I counted from 1 up through 5, and you come back to the room and your surroundings restored. So from this moment on, when I, you, or anyone of your choosing says the keyword daisy, inhale. 1, 2, 3. You will emerge from the deeply relaxed state to your normal waking level, your normal state of awareness. This will happen today and every day for as long as you choose, as long as you desire. Daisy, inhale. 1, 2, 3. Coming up, coming alert, feeling great. And now relax again. Lavender. Inhale. Exhale. 3, 2, 1, 0. You have slipped right back into that ultimate deep relaxation. So relaxed that it really doesn't matter where you are, what your surroundings are. You are in a pure amnesiac state, relaxed and calm. Lavender. Inhale. You are only aware of your deeply relaxed self, your baby, and your birth companion. Lavender. Short inhale. Exhale. 3, 2, 1, 0. You have successfully dismissed all of the distractions that could interfere with your baby's descent and birth. You are in an ultimate level of relaxation, bringing your baby to crowning in peace and calm. And now, once more, it is time to restore a state of absolute alertness and awareness, remembering that if you want to go back into your relaxation, simply use your keyword to go right into ultimate depth of relaxation. Daisy, inhale, 1, 2, 3, beautifully and normally refreshed and alert, wonderful in every way. All body functions are restored to their normal state, feeling energized and ready, feeling great. So I pray that the audio to vocal balance was appropriate. If not, let me know and I will record a separate session of what I just did so that you can do that on your own time as well if you want more practice. But I would love to know your thoughts on that as well. I love the hypnosis practice. It's just, I love it so much because it's the bread and butter of this whole thing, right? Okay. So ultimate deepening, we just did that. I didn't do the birth companions deepening. You have that in your spiral binder, so you can do that one together. It's really good practice so that your husband or birth companion knows how to use your voice to help guide you into relaxation. You're not going to read it like a newspaper. You're going to use a calm. The easiest way for us to explain it is try to use like your sexy voice, calm, gentle texture, right? So, not like harsh. So birth preferences. This is in your, it's page 25 of your Jeepers Cats spiral book with a workbook. I'm going to just name a few so you have an idea. And I did attach the PDF in the last email. If you need another attachment, just let me know if that one worked or if it's giving you any problems. But some very generic ones, right, are like dimming the lights, keeping conversations quiet and limited. Yes, you can literally ask for that. Playing music, relaxation tracks out loud so that everyone can know what you're trying to do, and for them it's like a really good reminder for everyone in the room to do the first two, right? Keeping everything dim, quiet, conversations limited. Keep some birth affirmations around you. You're going to be taking videos and pictures, like letting people know that's what you're going to be doing. birth partner is going to do the majority of communicating and just holding that space, right? So that unless you need to be brought out of your relaxed state, the conversation just can happen between them because you don't need to be bothered. Cervical checks, there's no evidence that shows that they do anything but tell the staff where you are in that moment, and they're quite uncomfortable because they have to reach very far in to check how dilated you are, but different hand sizes, different. It literally goes off of how they like space their fingers. They don't actually use a measuring tool or anything, so it's only as accurate as the person who is measuring you. So, being induced, you can just politely decline, and let them know that you're going to go for natural, spontaneous labor. So there are so many things that you can do before doing aggressive methods, right? You don't have to go right for, Pitocin or Cytotec, any of those, because it's much more aggressive, and it increases your risk of needing more interventions, and it increases your risk of cesarean section because they're so aggressive. Fetal monitoring, this is a big one. You do not have to accept the belly belt. You can, right when you get there, you can say, hey, I am really, sensitive, and it's very, very uncomfortable. Would you mind, my husband can, birth companion, whoever can just help let me know when you come in. Just use the intermittent fetal monitoring. It's what midwives at home births or birth centers use, and it's the most accurate method because they can directly find the heartbeat in that moment, and they can record it at that point. The belly belts, they pop off, they move, and there's plenty of studies that show that they don't do a justice to what they're supposed to do. So you don't have to do it, just accept that. Labor progressing in its own time, resting labor that actually happens. Sometimes your labor will take a break for you to rest. So you can actually take a nap or whatever you need to do, like eat, drink, maybe go to the bathroom. Labor stalling it's not a bad thing. It means that maybe your body is reading that you need a break, or need some rest. And so then take advantage, right? That's a good one to bring up with your provider, though. Like if they believe in allowing for labor to rest, as long as baby is looking good and you're looking good, with all your vitals and everything, then, right, it's nothing to be of concern. Membranes, vaginal exams, anesthetics, pain scales. You can say, we would love it if you could please discuss comfort measures, or comfort levels, rather than like just saying, what level is your pain? You can say, what level is your pressure? How strong of the sensations are they? Students, if you don't want students in the room, make that clear. Mother-directed birthing instead of like coached purple pushing, it's just not needed. So there are so many other options, position choices, placenta birth, delayed cord clamping, which most places actually already do that now because so many people have asked for it that they're like, oh, well, we can't harvest the blood anymore. Everyone knows about the delayed cord clamping to make sure that the baby has way less risk of being anemic, which is one of the top reasons that babies end up in the NICU. Intact perineum, so no episiotomy, positions, and gentle birth breathing. immensely helps. Just allow your perineum time to actually open and unfold like that image, so that you don't tear. It's very, very common for hypnobirthing moms to not tear. Anyone that allows for their body to birth calmly, it's very common for them to not tear. Express colostrum, bonding time, I would advise to look at the common vitamin K and hepatitis B vaccines and what they're actually for, like prevention wise, like treatment wise, because it's like standard procedure, but just look and see if you feel like it's actually something that you agree with or not. Because then you're going to want to look at that with other vaccines whenever you like actually have baby and you're going to the pediatrician. You're going to want to start reading on vaccines anyways, just to make sure, because informed choice is your right, and you just want to make sure that everyone's on the same page. And then the other portion is like cesarean birth preferences, right? I always say it's great to have like a plan B, and it's a piece of paper. You can always just tear it up and throw it out. It does not hold you to anything, right? Doesn't hold you to anything. Do a dry run with your provider. Let me go to the next one. Do a dry run, right? No like after hours entrance and timings to get there. Any like admission requirements. Just try to become as aware and aware of like the whole vision as you can, right? Do like the birth suite tour, like make sure that you see the rooms, get a sense of like where you can put some familiar items, where you can hang some things, make yourself comfortable when you're touring it, like walk through the room like you own it, because it's going to be one of the rooms that you're birthing in, right? And if the staff is exhibiting lack of support for your hypnobirthing birth preferences, you can ask for a different midwife. You can ask for a different provider, because there are multiple people who are on staff every single day. Make sure that you are aware of hospital policies with your birth preferences, because policies are not law. Policies are not law. So becoming aware of them enables you to directly cross-reference the discussions that you can have with staff, and just to reassure them, like, we appreciate what you are trying to do, but you are supporting us just as much, with meeting us in the middle with our birth preferences. Staff is made to feel like they're not doing their job if they're not doing it by like policy and procedure. So just remember that. Okay. When baby is nearly ready, baby turning into like vertex position from breech generally happens from 32 to 38 weeks, but not always, so no pressure. Baby will nestle into your pelvic area, and then it'll increase your labor warm-ups, right, and your practice surges, and then it'll also increase your vaginal discharge. Your cervix can start to show like the first signs of opening, right? Where you can have like your mucus plug release, which is crazy to think about, right? Breech is also a variation of normal. I will share an incredible video of a breech birth that it's one of the breech videos that I actually saved it because it's just so incredible, and it's the perfect view where the midwives just like let it happen. And I've actually had this discussion with my midwife as well, because I've met so many moms that have had surprise breech births, and they were aware that it wasn't anything to be afraid of. And one mom was taken into the OR to have a C-section, and they didn't even like get her prepped. She got up, squatted, and she delivered her own baby. of course, she delivered her own baby, but she caught her own baby in breech position because she's like, I'm telling you, like, I'm literally about to have the baby. And the staff gets so, they get in tunnel vision and they are so worried about getting sued. So they just like, try to avoid that whole situation. It's just not practiced. And that's why breech is a variation of normal. They can turn all the way up to birth. They are also known and have found to even turn like during birth. So even with surges, if you do different positions, baby can still turn. There's nothing set in stone, right? So some techniques, right, is like forward leaning, rebozo, shake a baby. Spinning babies is like internationally known for their techniques, which is amazing. Acupuncture, external cephalic version where they actually like externally rotate baby, moxibustion, chiropractic, and the fear release, right? Because releasing tension can release just enough more relaxation and space for a baby to move if they need. So, yeah, definitely have a conversation with your provider if you feel comfortable with birthing breech and just like what they're, how they handle that. So due dates are guess dates, right? Normal is 37 to 42 weeks. It's a super wide window where 265 days to 300 days is your gestational window. So it's more like a due month, not like a due date, which is where, people will start texting you like when you're close to your due date, like baby yet? And it's like, just release that pressure from yourself. When you get to 39 weeks, you don't need to be induced. Even 40 weeks, you don't need to be induced. So many times, first-time moms have baby by like 40 weeks plus 6 days up to like the most common time frame, right, for first-time moms is 40 weeks and 6 days to 41 weeks and 3 days. So just keep that in mind. You're okay. 42 weeks is completely normal. I've met moms who have given birth at like 44 weeks because again, it's birth month, right? And they found a provider that was okay with that. They just kept monitoring the vitals of baby and trusted mom to, to be aware of her instincts. And so they didn't rush it. Special circumstances, right? Prolonged delay in start of labor after membrane release, concerns about health of mother, membrane release showing fluid that is colored, has putrid odor, and has particles other than vernix. So that can be a sign of infection. And so that's where they would probably put you on antibiotics. Hospitals handle it different, but some would be already having a conversation with you about a C-section, or like inducing and trying to just get things, again, special circumstance, right? Change in pattern of baby's movement. That is something to be aware of where if you are in the third trimester, you want to always feel baby moving at some point in the day, right? You usually feel baby moving like multiple times in the day, and that should maintain. Severe ongoing headaches and dizziness, blurred or spotty vision. Be aware of that. That can have something to do with your blood pressure. And mother experiencing chills or fever, cord prolapse. So that is where if your water breaks and then the cord is under baby and gets pinched in between baby's head and your going this way, baby's head and your cervix, that is where the baby's getting their oxygen. And fun fact, that's why babies can safely be born in water, because they're still breathing through the umbilical cord. But if there's no flow to the umbilical cord, then that's where it's a special circumstance where they are concerned, because then you can actually monitor and see that baby's, oh, jeepers cats, sorry, give me 1 second. They can actually record and see that baby's heart rate is not really consistent, right? There's decelerations, and it starts to drop down towards like that 120 mark, and that's what they don't want, and dropping below. But mom should get off her feet, lift your butt in the air, and it'll relieve that pressure, right? And then an experienced midwife or provider, if it's not extreme, they can actually pop it. They can pop it back in. They would basically do like a cervical check, and they would be able to, because it's a very, very stiff, rubbery texture, purposely designed like that. And, if mom has her butt in the air, they can like gently like pop it back in with no harm done. That is not very practiced anymore. But that's also a discussion to have, right? So for the prolonged delay in your labor, 50% of moms start labor within 24 hours. Some, and then like the other moms, it will be like right after that, or, within like that next day, or your body just decides like, oh, well, we're not actually going to do it right now. And your body replaces the birth mucus plug. And so, you can always just you can have someone check you if you want, for them to confirm, right? So they don't like pressure you into anything. But your uterine plug can reseal, which is, the point of like preventing infection and everything. So just conversations to have. Vaginal bleeding or anal bleeding, definitely something to call about. Premature start of labor, 3 or more weeks early, make sure that's like measurable and everything. But yeah, definitely call, better safe than sorry. Severe swelling, right? Severe swelling where it's edema, where like you press and the indent does not relieve itself. Excessive or continued vomiting or diarrhea, definitely call, because I don't think anyone wants to be excessively doing that. Unable to sleep or quiet your thoughts. Also something definitely to call someone about, and just make sure that they have someone who is very experienced and a professional in like perinatal and postpartum depression, anxiety, and any of like the mental health frameworks that can be identified, which therefore goes into like the thoughts of harming yourself. So if you're ever in doubt, check it out, right? Better safe than sorry. Okay. So I think I'm going to stop here for halfway point, and then continue through the second portion. Here we are. Here's halfway through this first one, and then we will go on to part 2. Okay, welcome back. This is part 2 of class 3. We're going to start off on this slide introducing the discussion of chemical versus natural induction of labor, and why it's important to understand that from a medical standpoint, they are actually not supposed to recommend induction unless there is true, genuine concern for mother or baby, regarding their vital status or health status, etc. But in general, the cascade of intervention, right? Chemicals skew the effects of labor, hence, just making it chaotic or even stalling labor. Overstimulation of the uterus can be harmful for the mother and the baby. There's such a thing as exhausted uteruses, right? Where they will stop contracting because they're too stimulated or too exhausted, and baby gets overstimulated, and instead of having gentle rhythmic flexes of the uterus, when it's overstimulated, then baby doesn't have a chance to maintain homeostasis and calm breathing. Therefore, it's too much on baby. Inductions make you twice as likely to have a C-section. In some hospitals, 50 to 60% of first-time mothers induced end up with a C-section. And so if you're like me and afraid of something intense like that, then allow your body to naturally go into labor, and you are already that much more likely to have a calm natural birth. There is something called the Physician's Desk Reference, as well as ACOG, the American College of Gynecology, and they reference, and not only that, but they discuss that, whether it's the gels or the artificial oxytocin, syntocin, Cervidil, it is not, I mentioned this kind of vaguely at the beginning, but it is not recommended for induction of labor. It should be used to initiate labor only when there is genuine reason for concern. So if, there's like abrupt change in, baby's behavior, and there's no sign of baby's like movement, or mom's vitals are crashing, dramatic things like that. But no need to put that on yourself. Just all in all, artificial chemicals, they're just very, very abrupt on our systems, and nature is amazing, and our bodies are perfectly designed to do this. So there's no need to throw some chaos in there. Bishop score. This is gone over in the book on page 240, and this is a method where it's used to help determine whether your body is ready for labor or not. And so you can see on this chart, right, they go off of position, consistency, effacement, dilation, and station. So position of baby, posterior, mid position, anterior, or second anterior, where posterior is where they are facing towards your back, anterior is where they're facing towards the front, mid position is where they're just side lying. And then consistency of your cervix, right? Firm, medium, soft. And then effacement is where you're thinning. So 0 to 30%, 40 to 50%. Dilation is where your cervix is actually opening. And the effacement is where it's like thinning, right? Station is where baby is actually stationed in your pelvis. And that's what those numbers actually mean. And so they can get a general consensus on where you are in your Bishop score, and that can actually help determine if your body is going to take to their induction methods. Because if you're super early on and your body is not showing any signs, like if you're a 0, your body's not going to take to it, right? If you're a 1, low chance. If you're a 2, you're much more likely to have your body kind of flow with it, since it's already at like a 3 to 4 centimeter of dilation. But ultimately, you want to be a 3 or higher, because your body is already in the rhythm. Natural methods to induce. Hot and spicy foods, hot and spicy lovemaking. How you get pregnant is how you also get out of pregnancy. Nipple and clitoral stimulation, because it releases oxytocin and endorphins for mom. Acupressure, acupuncture, massage, fear release, because of course tension, right? Walking, visualizations, and relaxing and just letting go, instead of, don't let people pressure you when you start to get close to your due date. We started to talk about that earlier, but You'll get the text messages, any baby yet? Don't mind them. Just know your body has its timing. Baby is communicating with your body. Their lungs are developing so that when they come out, they're breathing nice and strong. So other people's timing can wait. You and baby know when it's time. Gifts prior to birth. So your body's perfect design, right? Your body and your baby working with you and for you. This information is covered in pages 119 through 135 about instinctive birth, right? So we've explored the laws of the mind and how to, empty. We're going to do a fear release at the end. I figured I can throw it in this second half. Instead of having in that first portion where it would have been a lot of visualization and a lot of hypnosis practice, but ideally using that critical factor, right, to reaffirm and basically get out those negative thoughts and beliefs and excuse me, and false truths, right, about giving birth instinctively. So we're going to discuss the gifts that nature has already provided. So, how and why birth can be accomplished instinctively, right? And for pregnant women, this is just like really great to know, because how many times do you have people just be very excited to tell you all like the scary things and the things that you like don't want to hear. But the beautiful thing is our body is already prepared to birth instinctively because the chemical release is there, the anatomy is there, the psychophysical association is already there, the natural laws are defined and are already there to work for us and with us. So it is monumental that you understand that all of the psychological and physical and spiritual gifts that we have already with us before you even birth. A few things to go over about, just recognizing key factors to be able to recognize when you are getting close to going into labor. So the formation of the uterine seal, right? Some people refer to this as the birth show or the mucus plug, but this forms at the time of conception because it protects baby from exposure to bacteria, or it protects you from potential infection, right? Therefore, when if you are in labor, unless your water breaks, which only 30% of women who go into labor, their waters, only 30% have their waters release. And so if your waters don't release, then you're really still not at risk of infection, because the only way that you can like really be at high risk for infection is if people keep checking you, right, and introducing possible bacteria. If the clean environment is left to its own accord, then you're not introducing new bacteria. It's important to make note of. Cervical change, right? Hormones will soften your cervix to the suppleness of an earlobe. So on the Bishop score, it was saying, the texture, right, goes from like hard to soft, and it goes from like your forehead to your nose to your earlobe. And that's the texture that you can kind of relate to, right? But relaxin really starts to kick in and soften those. Endorphins. Regular relaxation practice, right, helps to release the endorphins, inhibiting the secretion of catecholamines. Those catecholamines are the those are the hormones that we do not want, right? That's going to create constriction in our blood vessels, constriction in our ligaments and our muscles and our birthing muscles, right? So we want that oxygen flow, we want the blood flow, we want the relaxin and the endorphins to be released and the oxytocin to be released so that everything is working as it should be. Baby is in position, right? Baby gets in position. The relaxed uterus gives optimal room, right, for baby to turn into the vertex position. Even so, right, we kind of went over baby being in breech position. Babies can still turn even when you're in labor. And there's all those other methods, right, with spinning babies or the external rotation. But again, between 32 to 37 weeks, that's usually when baby will turn. But it's still not something to like stress about. You just talk with, your midwife or your supportive provider who won't pressure you when, remember, we went over breech is another variation of normal, right? Engagement when baby actually starts to, this is when people say you drop. But 2 to 3 weeks prior to birth, baby may move down where the widest part of their head will be at the widest part of like the midsection, right? Of the pelvis. So, and not all babies will do this because of course it's, a few weeks beforehand. And that's okay, right? All in their own time and on their own schedules. Relaxin, this is your best friend. Beginning at 24 to 26 weeks, the hormone relaxin is released prior to and during labor. It's really a beautiful, beautiful hormone. It weakens the amniotic sac for release. It causes your ligaments to soften, and the ligaments in baby to soften so that they are quite literally relaxed. It also allows for natural lubrication for easier descent of baby. So that's where you'll experience that increased discharge, as we mentioned in part 1. All good things. Prostaglandins. So nearing birthing, a small amount of pre-labor opening may be experienced due to the release of prostaglandins. Eventually, it triggers oxytocin, and it's believed that the baby initiates labor, and they did find out in some studies, they're still doing so much research because birth and breast milk, I mean, so many things about birth and just all things with mom and baby. They're still trying to find out so much information, and because it's such an intricate and fascinating and perfectly designed process, it's really quite amazing. But there was a study that they found out that there is a white blood cell release correlated with the development level of baby's lungs that is communicated to mother's body, and then our mind signals our body. So it's initially baby, right, that signals our body to go into labor because their lungs are developed enough. Fascinating. Oxytocin is what causes your uterine surges to begin and release the uterine seal. Oxytocin is that super crucial one there. So your uterine surges or waves, right? This is where we talked about the blue ribbon, the blue satin ribbon visualization. Your longitudinal or vertical muscles, they smoothly draw up, right? The lower muscles out of the way so that baby's head can gently nudge down and slightly apply pressure to help the cervix like short, thin, and open. And then the surges, they continue to propel the baby out into the birth path. And you can, again, your surges can rest for a while. It just depends on the communication of you and baby and what your body receives as a message of what you need, right? So there's no need to worry if your labor takes a nap. Time distortion. This is another gift from nature. It really helps you to just lose track of time, and it shifts your ability even more so to just stay in the moment and just focus on your birthing body. You're able to stay like more relaxed, right? More focused, and your body is able to birth actually faster when you kind of harness that time distortion. Gifts for the birth phase. Indeed. This is a really cool picture, by the way. There are some really cool birth centers around America that have some incredible birth tubs. And some of them have like a clear front area that the midwives and doulas can see through the front, and just can see how mom is progressing instead of having to have her, sit back or just change her position. She's able to just do whatever she's doing. And they can see progress from that point and see baby crowning or birthing, and it's really cool. So the actual birth, right? The actual birth phase where baby is crowning and coming out. The needless fear of this stage is, there's really no need for it. There's no pathological reason for pain in this second phase of birthing. Nature, quite frankly, just steps in and takes over the course of labor. You don't have to purple push. You don't have to hold your breath. Nature really just like takes charge, and baby is coming out, right? Baby is going to, if you allow and work with your body and breathe, baby's going to gently crown and emerge. And then ironically enough, once baby's head is out, the rest of their body comes out very, very quickly. So it's pretty rapid. The amnesic state, a feeling of deep relaxation drifts over you as you shut out your distractions. So again, if you allow yourself to stay in that focal point of just relaxation and through like the thinning and opening, and allow your body to connect with baby, right? Then you can just focus on your position as being relaxed and not putting too much effort into doing anything like physically, because your body is birthing with you and for you, right? Distractions are just going to kind of take you out of that. Some people, this is where I mentioned earlier that some people like will distort like what they see around them and what they hear around them. Excuse me, I'm talking too much again. But the amnesic state is another version of this. Fontanels. I feel like moms aren't told this enough because they're afraid of birthing baby's head, but baby's head has these things called fontanels, right, in their skull, and it's purposely made like that so that baby's head will like cone and be easier for birthing. So then baby's head is smaller and it is like gradient. It's quite literally like, like a cone. So it's smoother and easier for birth, which is amazing. Absolutely amazing. And then once baby is born, then usually within like a couple hours, baby's head just gently goes back to normal form. And then throughout time, up to about 2 years, because some babies take longer than others, but the fontanelles will fully fuse together at that point. So this is another gift of nature. Natural explosive reflex. This is amazing. I pray that everyone can experience this in their birth and utilize this incredible bodily function. I tell people a lot of times you've already experienced this at one point or another in your own bathroom visits when your body makes you involuntarily push, like you can feel everything flex. And it's so the natural explosive reflex is where the lower sphincters move baby down, right? The birth path. And this is done by the body. This is not done by you. Hence why it's called the natural expulsive reflex. So if you've ever gone to the bathroom and you felt that, where you can't like help it, the natural explosive reflex is that times like 100. So very powerful because our uterus and our birthing body is so strong. And that's why it's really important to remind yourself to breathe as much as you can through it, because some people can't help but push with it because it feels great. And that's okay. You just want to try to breathe as much as you can to avoid restricting the airflow and the blood flow just as much as possible. But yeah, you don't need to force your pushing or anything. It's optimal if you let the natural explosive reflex do what it is designed to do. Your perineal folds, as that birth drawing image of the flower with the baby's head in the middle shows, your perineal folds open and stretch, right? They especially with the relaxin, our body will gently unfold. It is amazing. There are plenty of pictures that will, I apologize. There are, yes, pictures as well, but there are plenty of videos that show you how incredible our bodies are, and they will gently stretch with baby's head, right? The space that I'm making is not the actual size. I'm being like dramatic with my hands. But because baby's head cones, it's gonna start off like a little bit and then just gently, right? Gently around baby's head. And then that's like about it, right? And then just it'll stretch around baby like a bowel movement, but with your vagina. But it will make space for baby. The relaxin helps with that, and we're designed to be able to give birth. So your perineum, when you breathe, when you're crowning, then just so many things, right? With the relaxin, oxytocin, endorphins. Jeepers cats. I gotta slow down my yapper. I love this information though. It's just amazing how this information just proves how intricately designed we are. But lowering the risk of tearing, right? Just staying relaxed, breathing with it, and allowing your body to do what it is supposed to do instead of fighting it. And knowing that every sensation and pressure, angle, and movement is natural to happen. That's where you hear like don't fight it, like flow with it. Yeah, it really does make a difference. The umbilical cord. The umbilical cord is so amazing. The umbilical cord stops pulsating after the baby has absorbed a sufficient amount of blood and is able to breathe air on his or her own. Again, at 37 weeks, the part of the brain that develops the pressure sensor where they can differentiate the pressure around them of like their atmosphere is developed. And so that is one of the key reasons as to why they want you to be 37 weeks to be in water, to birth, or, because then it tells them that like lung development and everything. But the cord is what supplies baby with blood and oxygen until they are born. And so when you see baby born, they're still getting oxygen from the umbilical cord. So that immediate response, it's really not an immediate concern if they are still like sleepy, and if they have a super calm birth, they don't need to be screaming and going crazy, right? Because what if it's like nice and warm in the room and like they stay nice and warm on mom? Not all babies are going to cry, and moms will just give them a few seconds. I say a few seconds, but it's more like maybe like, I forget the actual amount of time that they, like in this moment, the amount of time that it takes for the umbilical cord to like fully pulsate the blood and oxygen to baby. But honestly, at least like a minute or two for the blood and oxygen to pump back to baby, and they will stir and come to once the umbilical cord is not pulsating anymore. It's really fascinating, but you can see how crazy the texture is on that umbilical cord. It's so amazing. And I mentioned how the texture of the cord, because it's so like thick and rubbery, if someone had a cord prolapse and it's not like all like extremely hanging out, then an experienced provider or midwife can have mom do an inverted position, and they could pop the umbilical cord back in so that it's not pinched, and then they can monitor and move forward with a normal natural vaginal birth. And again, just another tidbit about the umbilical cord. The reason that you want to wait on the umbilical cord cutting is because it holds about 30% or a third of baby's blood volume. And again, that is because I mentioned this quickly. It's one of the most common reasons why babies end up in the NICU when hospitals just automatically clamp and cut the umbilical cord. It cuts off about a third of the baby's blood. And if we lost about a third of our blood, it would not be good. We would definitely feel it. So it's important to just let baby get their blood, right? Placental release. As baby breastfeeds, more oxytocin is released, which helps release the placenta and enhance the mother-baby connection. I've been reading this incredible book. I'm always listening and reading to something baby, right? And pregnancy. And there have been multiple studies done with different cultures and different environments across the world, and that skin to skin is so pivotal for a mama and a baby, and the well-being of mama and baby. Babies' APGAR scores who cuddle with mommy or daddy just for like uncontrolled amounts of time, they thrive. Their ability to self-regulate, their temperature, their vitals, their breathing, their breastfeeding, just their awareness of like latching and all the things, they flourish. Yeah, so just something to keep in mind. Okay, releasing fears. So we are going to do the fear release script. And again, I really hope that the sound to vocal ratio is appropriate. So you just let me know. I'm going to review the videos, of course, and if it is not appropriate, then I will re-record it and give it to you in that form, so then you can probably I'll probably cut this portion out if it doesn't work, and then you'll have the separate audio to utilize. So I hope that you did some contemplating and just thinking about what you feel like are your top 10 fears or top 10 stresses that you need to let go and release. And then we will get into it. So again, just that's awesome. Okay, get into a comfy position. And this is the second to last slide. So this is like the last thing for this class pretty much. And then we will we'll move on to the 4th unit next week. How crazy. Oh my goodness. Only 2 classes after this, and you know, it's really amazing to have. It's a plethora of information, but this program really does work. I don't think it helps that I'm drinking chamomile passion flower tea. But okay, I have the music in here. I hope you got situated. I'm also going to situate myself a little bit better. Okay, here we go. I'm going to play the music. Okay. Make sure you unhinge your jaw, relax your hands, let your shoulders slump. And we're going to gently close our eyes to get into a comfy position. You can lay down, sit back on your couch. Don't force your eyes shut, right? Don't hold them shut. Just allow them to gently meet and feel how comfortable it is to just allow your eyes to remain gently closed. Place your awareness now on your breathing. Breathe fully and breathe easily. Let your breath flow all the way down through your chest and your stomach. Let it drift all the way down through your body. And as you feel the relaxation drifting throughout your body, you become aware of how heavy the muscles and the cells in and around your eyes are becoming. Your eyes are now closing more thoroughly. It almost seems as though they are sealed. And now they feel as though they are locked shut. You know you could open them, but as you try, it seems to be too difficult. Too difficult for you to open your eyes because they feel so comfortable. Now just imagine that same deep relaxation, drifting down over your cheeks and your jaw, your face, and your jaw sets the pace for the rest of your body. And you now feel your shoulders begin to feel relaxed and limp. All tension drifting away. With every breath, you relax more and more. Let relaxation gently caress your body into a deep state of comfort. Feel all tension melting into the earth, just as the soft spring rain soaks into the ground. Feel yourself relax more and more each time you exhale. Let the relaxation drift down throughout your body. Trust that your body will relax more and more as you continue to move through these kinds of thoughts. Allow yourself to gently drift into a deeper state of relaxation. Hear the soothing strains of the music. Let the rhythm of the music flow through your entire being. Feel that flow and feel your body go deeper and deeper into relaxation. As your body becomes more relaxed, you are becoming more aware of your mind. Imagine that your mind is as vast as the sky, as it truly is. Imagine a breeze drifting through your mind and clearing it of all outside thoughts. As your mind clears, your imagination becomes fluid and free. Thoughts become lighter and misty, as though they were soft, white fluffy clouds, drifting in the most beautiful blue summer sky that you have ever seen. And now, in your mind's eye, see yourself under this beautiful blue sky at your favorite place in nature. A place from your childhood, or maybe even a spot that you are fond of now. See yourself there. This is a place where you feel so safe and so secure. A place where you can be yourself and take joy in it. A place where you can be alone and yet never feel lonely. A place where there is no tension or pretension. So safe and so secure. Your conscious mind remained at rest here in your favorite place. And watch now as your thoughts pass through the soft mist of your mind. feel so comfortable to let your mind relax. Give yourself permission now to relax both physically and emotionally. Imagine letting go of all anxieties, fears, frustrations, self-doubts, disappointments, and even the fatigue of life's daily demands. See them all being washed away as though by a gentle shower of soft cleansing rain. Give yourself permission to be emotionally relaxed and free of all negative thoughts. Feel how wonderful it is to release all of these intrusive emotions, emotions that needlessly offend your mind and your body and cause you to have doubts or fears about birthing and parenting. Feel how great it is to be completely and fully, physically and emotionally relaxed. Nurture yourself now and appreciate this wonderful miracle of nature that you are a part of. Think of who you really are. Feel yourself totally in your quiet mind. You are now ready to go deeper within, entering into a place of deep knowingness, the true source of your awareness and knowingness. Anchoring deeper and deeper. I'm going to count from 10 down to 1. And as I do, you will feel yourself going within into the very core of your awareness. 10. Releasing and relaxing more with each breath. 9. Moving deeper, turning to your inner self. 8. Moving into who it is that you are. 7. Softly, gently moving down inside yourself. 6. Going into your inner essence, whatever you sense that to be. 5. Moving down into your place of wisdom. 4. Beginning to sense the core of your own wisdom, the wisdom that brought you here, because on a deeper level, your knowingness tells you that your own deep palm breath. Relax. Breathe. is your birthright to be gently and easily. You've come here to claim that birthright, to trust in yourself and your body. Moving to 3. Moving to the place where your knowingness will reveal to you the determination, strength, confidence, wisdom, and the trust that you seek to gently and easily bring your baby into the world. 2. Now at the level of your inner being. And 1. You are now at one with your inner being and have reached your own special place of power. That power that's been within you always. Your birthright. Claim it now and make it yours again. You are now ready to go deeper into your own place of wisdom and the true source of your own awareness. And now that you are so thoroughly relaxed, take yourself in your mind's eye to a wonderful healing room at the very core of your subconscious. This is a beautiful room of soft blues and greens. As you look around, you see a large, comfortable chair. Give yourself permission to sit in this chair and get comfortable. By your side is a large white book. This book is the history of your life and your beliefs as they are recorded in your innermost mind. It's a lovely book, but some pages of the book contain images and experiences, beliefs that may have planted seeds of doubt or fear in your mind concerning your birthing and the effect that bringing a baby into the world will have on your life. Some of these pages hold images of experiences, stories, relationships, fears that may linger from things over the past or others that have passed on to you, movies you've seen, conversations you've had, literature you've read, even comments that well-intentioned friends are passing on to you even now. To protect you from any emotion that you may see, so that you can observe the scene as though you were simply an onlooker. There will be a large sheet of plexiglass between you and the book. What images you recall, you will witness without feeling any deep emotion that may have surrounded the event or experience. See yourself now opening the book. Take your time. Search through the pages of the book one by one. When it's your subconscious and it reveals a picture that depicts a fear or a concern that you may have, any limiting thoughts about birthing or that betrays birthing in a negative way, a comment, experience, or whatever it may be, pause and study that page. See it for what it is, case of a birthing scene, recognize that it is someone else's recollection that has been passed on to you. Perhaps it could be a birthing experience of your own, maybe an earlier birth, or the story of your mother's birth, and it didn't have a calm, hypnobirthing confidence. You or someone else were programmed with someone else's comments, birth stories, influences. Study the thoughts that are looming on that page. Bring them up, make them larger. And see how they colored your thinking. And now quickly take all of the color out of that image. Let it turn gray, getting lighter and lighter, fainter, fuzzy, smaller. And now the picture seems to be disappearing right into the surface of the page. Now all you can see is the beautiful texture of the paper. The page is absorbing all of the emotions surrounding the hurtful image. Like a sponge, the texture is drawing away all of the negative emotion. As you look, all you can see is the beautiful, clear texture of the page. That page no longer belongs in the book of your life or your thoughts. Rip the page right out of the book, tear it out, crumple it up as tightly as you can. Continue to search through your book. Maybe there are other memories in your life that you may want to eliminate. Here is your chance. Any event, person, experience that you want to release it. Find it. Each time you come to a page that contains some image that you want to release, continue to do so as you did before. Let the image come up. Watch it fade and disappear into the page. And then rip the page right out. Tear it out. Crumble it as tightly as you can. And then put it aside. Your subconscious works quickly, so you can move right along, quickly finding the images you want to release. Keep searching. Continue the process. Continue to search and identify those pictures that could create tension or fear. Questions surrounding your birthing or adjustments that you'll make in your lifestyle. Fear of imitating someone else's parenting ways. Maybe comments, experiences, or myths. Find them and release them. Now prepare to bring your work to an end. And don't worry, if if there are still more images that you need to release, we can always go back and pick them up another time. But now that you've ripped these negative pages from your book, you're ready to move on. Gather all the little wads of crumpled paper together, all those pages that carry the emotions, limiting thoughts, and fears you're releasing. In your mind's eye, now place those pages into a disposable paper bag. Stash them in the bag with all your might and push them down into the bag. Looking to your right, you become aware that there's a cabinet in the wall. A cabinet that looks like a kitchen cabinet. Open the cabinet and throw the bag into it. But now you see that this cabinet has no shelves. Instead, there is a long chute, similar to a laundry chute. Watch as the bag goes down, 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 and down. And now it's landing into a huge incinerator. Watch as the flames completely envelop the bag. It's now difficult to see the outline of the bag. It's all turning to ash. The bag has disappeared. Now watch as the flames engulf each of your wads of paper. Their shape is disappearing. The emotions and fears are being destroyed. First a red flame, then black, and now everything is just gray ash. Becoming fuzzy. It's all so fuzzy that you can hardly see anything but the ash. Now the chute is turning into a wind tunnel. It's blowing the small, minute pieces of ash out over the landscape of your mind. You can watch them go up, so far out over the landscape of your mind. They are getting lighter and lighter, and fuzzier and fuzzier, so much that now you can hardly see them at all. Now they are gone. They have fallen over the horizon. The emotions attached to those negative thoughts and events have been completely destroyed. They're gone. They're gone forever. And now you feel so calm and free. Return to your chair and your book. Take the book again and open to the middle of the book. What a wonderful scene. It's you and your birthing companion. You are holding your newborn baby. You look radiant. Your eyes are sparkling. And there's a beautiful light all around you. You look so relaxed, refreshed, and happy. Your birthing is over. You had your perfect birth. you did. You experienced your birthing just the way you wanted it to be. And now you are so elated. See yourself in your favorite colors. Let those colors and that scene come up so big. This is one picture that we are not going to release and destroy. We're going to save this image and think on it many times during the time between now and the time that you give birth. Enjoy the scene. And now that this scene is so large, it's lifelike. See yourself in your mind's eye, getting up from your soft, cushy chair and stepping right into that wonderful scene. Step into the page. And this is no longer a picture. It's you standing in this body. There's but one body, the body of success. Feel it, sense it. Let the feelings of happiness permeate your entire body. Feeling your arms wrapped around your new little baby. See your baby's gaze meet yours for the first time. Experience how wonderful it is to be a part of life's miracle of birth. You've done it. You knew you could. You've had your easy, comfortable, beautiful birthing just the way you and nature intended. And now, with all of your newly found confidence and trust, you now know you can do it. Now you've seen it and felt it, the joy of it. Take a moment to choose in your mind just what you will experience through your labor. Will it be tightness, tingling, pressure, an energy flow, a sense of weight, numbness, or heaviness? It's your choice, and you can choose now. Think of the length of your labor. Think about how much time you will spend in labor. Will it be less than 10 hours, 5 hours, or 3 hours? So take a few moments to see yourself wrapped in a relaxing mist of your birth color when you are in labor. And all you will have to do is envision yourself in this birth color, and deep relaxation and comfort will be yours. When you are ready, you're going to get up from your chair. You're going to bring your awareness back to your body. Return to your conscious surroundings. Restore your senses. Begin to move your hands and your feet. And in your own time, come back to the room, confident, refreshed, filled with excitement for your birth. Alrighty. So that is a pretty lengthy one. Of course, with purpose, right? My computer skipped to the next slide, but thankfully we were like right at the end there. And this is the last slide. So now that you have your toolbox of techniques, right? You're going to have the hypnobirthing book and the spiral book, so you're going to have everything there, but you have the rainbow relaxation audio that you can be using daily already. Your affirmations, practicing your facial relaxation, the progressive relaxation, your calm breath and your surge breath and your birth breath. You guys can just take turns kind of like helping anchor each other, and still figuring out and just having fun with the light touch massage, making sure that you're eating balanced, right? Drinking lots of water and getting movement in, and practice that bonding with baby and each other. So now you're going to add in some of those visualizations like the opening blossom or your birth color anchor, deepenings. Maybe play around with which one you really take to, so that you can have that to utilize in your birth as well, whether it's the depthometer, the glove, or the switch, right? The sensory gate, the valve. Then you'll have the birth companions deepening for the partner to read in the spiral book, and start to do that dry run and have those conversations with your provider, and just make yourself comfortable in that environment, right? Figure out where you can like set some things up in the rooms to familiarize yourself and just make it more your own, and talk with your care provider. So I will be sending you that class 3 email with some extra information and references for you. And I hope that you guys have an amazing rest of your night, and I will see you next week. Alrighty. Have a good night.